3 things I wish someone had been brutally honest with me about before I became a speech language pathologist. Hi, I'm Sam. I am an absolute burned out former SLP who is resetting her entire life after working in public education and then healthcare for almost 5 years. And so here's a few things that I wish someone had told me before I picked SLP as my career. Side note before I start is that this was my dream career. I truly am devastated. It feels like the worst breakup of my life to leave this career, but I knew it's what I had to do for my physical and mental health and my future just overall wellness. So let's get into it. But this all breaks my heart that I even have to share these and that these are real things that we're dealing with. Number 1 is productivity. Productivity is the amount of patient-facing time or student-facing time that SLPs, OTs, PTs, we have to be during the day. And most productivity levels are like 80% or higher. So think about that in your day. You have to be patient-facing 80% of the time or higher, or they're going to keep telling you you're not hitting your productivity. It's like these are unrealistic standards, but looking back when I chose a career in speech language pathology, I genuinely don't think productivity was as big of an issue as it has become today, especially after COVID. So just know that you are going to be pushed and pushed and pushed to see more and more and more patients, and that is not on you. That is on these systems failing. Number 2 is a full workload / caseload. I was thinking back to graduate school, and I don't think grad school truly can prepare you for the full workload or caseload of an SLP. I just don't think there's enough time. And I went to one of the best grad schools in the country for speech pathology. I love my professors. I had an amazing education there, but I don't think it is really possible to give you a full workload as a student. So I just think you need to be prepared that in your clinicals in graduate school, you're doing like maybe 50% of what the SLP truly does, because there are so many things that your supervisor is doing that you probably don't even know about. Last but not least for today is systemic issues are not your fault. I literally am pounding my fist when I say that. Healthcare and education systems, they have collapsed, and it is not your fault. It is not your responsibility to pick up the pieces around you because of the systemic issues that leaders and corporations in these countries have done to us as employees and our patients and our students. These issues are not your fault. And it's going to feel like this heavy burden of like, oh my gosh, I'm not seeing enough people. I'm not hitting my productivity, blah, 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 all this stuff. It's not your fault. It is not your fault. And if no one is going to tell you this, I will. It is the systemic issues. It's their fault that they are destroying these systems, destroying patient care, destroying education. It is not your fault.